Good morning. Welcome to the November edition of Eye Openers, our monthly video blog for North Shore Eye Health and Wellness. I'm Dr. Kyle Ross. Today, I want to talk about a couple things. First and foremost, tomorrow is Veterans Day. So happy Veterans Day to all the members who have served in our military across the country. I'm very proud of my time as a United States Naval officer. I served at the Captain James A. Lovell Federal Healthcare Center in North Chicago as an optometrist from 2011 to 2014. Great time in my career, very proud of my military service, and always reflect back on that as a very important part of my life. So happy Veterans Day to all you veterans out there. Enjoy the day, and hopefully you have a good one. The other important thing I think to talk about for November is November is National Diabetes Awareness Month. Diabetes, as we are mostly all aware of, is a growing problem in this country related to a number of different factors, and I'm not necessarily going to get into that today, but what I do want to talk about is how diabetes can impact the eye. Right now, diabetes and its damage to the eye is the leading cause of blindness in adults. It battles with macular degeneration, and when the numbers come out every month, sometimes diabetes is number one, sometimes macular degeneration is number one. But nevertheless, it is a very destructive process in the eye. Diabetes damages the very small blood vessels in the eye and really throughout the body. But when this happens for the eye, those blood vessels that feed the retina, that's the tissue inside of our eye, if those blood vessels are damaged, we look into the eye and we can see leakage. I see little bleeds. One of the reasons we want to have a dilated eye exam every year for our patients who have diabetes is so that we can detect these early changes. It's all about blood sugar control and how long we've had diabetes. We're going to see these changes, and it's not the end of the world if we have those small changes. What we want to prevent is the more significant changes, kind of like a domino effect. As things go down that road, the retinal tissue can really be impacted. So we want to see you every year for a dilated eye exam if you're diabetic, and then we also talk to you about ways we can slow down this process. How can we make our blood vessels healthier? And I always talk to the patients about the ABCDEs of diabetes control. First and foremost, you always want to know what your A1C is. That's what the A stands for. Your A1C is your 3-month blood sugar reading. It's a blood test, and it kicks out a percentage. Really, I think anything under 7% is considered good, but for the eyes, I really like to see my patients 6.5 or less. We know if we are 6.5% or less, it significantly reduces our risk for developing the damaging diabetic eye disease, what we call diabetic retinopathy. B stands for blood sugar and blood pressure. We want to make sure our blood sugars are controlled on a daily basis, and we want to make sure our blood pressure is also controlled. C stands for cholesterol. This goes hand in hand, right? Diabetes, damaging small blood vessels. Blood pressure deals with that, blood sugar deals with that, and cholesterol deals with that. If we can keep all of those areas healthy, our vascular or blood vessel system will do better. So that's A, B, and C, A1C, blood pressure and blood sugar, and cholesterol. D stands for diet. Diet is very important. Remember, with diabetes, we want to control our blood sugar levels. We think of sugars, we think of candies, cookies, cakes, ice cream, right? Well, there's more to it than that, and sometimes the sugars that we often mistake or don't think about are things like potatoes, cereal, rice. There's lots of things that have carbohydrates in them that are hidden, so I encourage all of my patients to work with a dietitian or a nutritionist and make sure they're on the proper diet. E stands for exercise. We want to be getting at least a half hour of kind of vigorous exercise every day. If we are overweight, we don't want to jump into that too seriously. We want to slowly work ourselves up to the point where we can get our heart rate up safely, but at least shooting for a half hour of exercise a day is a good start. And then S, A, B, C, D, E, S, E's. S stands for no smoking. Smoking really damages our small blood vessels, even healthy people, right? And so if we're a diabetic, we certainly don't want to smoke because that's going to increase the risk for having significant damage in the eye. So for November, Diabetes Awareness Month, make sure we're following the ABCDEs to control our condition. And then finally, get in for your annual eye exam so that I can communicate with your primary care physician, so that I can communicate with your endocrinologist, and we make sure that we're working together to keep your diabetes under control and to keep your eyes seeing healthy for the rest of your life. Thank you. I hope you enjoyed this episode. We'll see you around.